The College of Human Medicine is a community-based medical school. We have 6 campuses currently around the state in Grand Rapids, Lansing, Flint, Midland, Traverse City, and Marquette. We educate 800 students across those campuses, and they do their 3rd and 4th year clinical rotations in all of those sites, and we've been present in many of those communities for close to 50 years. Being a community-based medical school means that we are connected throughout the state, and we've been working very hard to build a statewide research network, because research is a big part of how we engage in these communities, working closely with clinician scholars in those communities, with our hospital partners, with the students and residents who are in those communities. So research is really foundational to what we do in working with our partners, and this extension health research activity is part of building that statewide network. So community-based researchers need a number of different things that I think extension specialists and extension educators are uniquely prepared to provide. First of all, they need community connections, and many folks in extension have been in those communities for 30 or more years. They know everyone, they are known by everyone, they can make those kinds of connections. Secondly, what is often forgotten by those outside of extension is that much of what is done, especially in the Health and Nutrition Institute, is about human health, and that there are training programs and educational programs that are already directly impacting people's lives and having important outcomes. And this is important not only because we can learn from these programs and we can include them in research activities, but the people providing those programs are also experts at what they do. And the opportunity to perhaps include a diabetes educator in a funded research project will only make that project better. And I would say the other thing that extension specialists, extension educators are remarkably good at is talking about and disseminating what they do. And often research scientists are not so good at that activity. And so the marriage between a really accomplished, well-funded research scientist and an extension educator who understands dissemination toolkits, understands how to reach audiences with different kinds of modalities, can be a very powerful tool in getting the research that we do out to communities and establishing why the next phase of the research is necessary.